next. Got it. Yes, recording in progress. Well, so what I would like to do is share with you all kind of the synopsis of the prior meetings that we've had. So we've had two design work group meetings, and then there was also a meeting just with lived experts. That was 2 weeks ago, although I don't trust my sense of time anymore. But so just to kind of reflect back to everyone, like all of the input that has come up, the major themes in this work, and I will share this on my screen in just a minute and talk through it. And I think the main point here is like, did we get it right? Did we hear you? Did we capture the feedback accurately? Is this feel like a good reflection of the work we've done as a group? So let me share my screen. All right. So so the first kind of thing in this bulleted list are the key themes that have come up in our design work group meetings. And so an intent that we're not reinventing the wheel here with this Lifeline program, but that this would serve as a complement to other existing hotlines and services.
Kim, excuse me for interrupting. Is there a way you or Aaron can make this bigger?
Yeah, I can do that.
Thank you very much.
How is that? Can folks see that?
Yeah, I think that's
okay,
much
great.
better. Thank you, Kim.
No problem. So again, not to reinvent the wheel, but for this to serve as a complement to other existing services and hotlines. And sort of alongside that the Lifeline should focus on filling gaps where other services aren't meeting the needs. The intent to create a one-stop shop access to any services needed, and that those services needed are defined by those who are accessing the Lifeline. That the Lifeline should be relational, not simply a referral line. There was a strong theme around peer navigators and an emphasis on those with lived experience to be the staff or part of the Lifeline. That this would be a statewide resource designed to serve anyone in Washington state. We had this theme around this, we've kind of converted it to this term called case completion, but essentially the theme here was that anyone who accesses the Lifeline their case wouldn't be closed until it's resolved. So someone would essentially kind of walk alongside them and ensure that their needs are fully addressed through the process. And then another big emphasis through these meetings has been on the advertising and marketing aspect of the Lifeline. I think a lot of what has surfaced is people's experience of being unaware. We did the landscape analysis of all the things that exist. And I think, there was a reaction to like, wow, there's a lot of things that exist that people don't even know about. So if this is going to be effective, the Lifeline needs to we have to make sure it's advertised and marketed, and to take multiple approaches to do that, which would include outreach with trusted partners, a website with a term I only recently learned, search engine optimization, which basically helps you, brings things to the top when you search in Google for something, social media, potentially a mobile app, evaluation as a component. So that could be through a customer survey or text push notifications, but some way to get some feedback to evaluate the effectiveness. And then an interest in essentially an advisory group. And we'll talk about this later in the meeting and next steps, but ways for people to participate in an ongoing way. So beyond just this design portion of the process, but how to participate in an ongoing advisory role. And yeah, again, we'll talk more about what those opportunities may look like going forward. And then, so as you know, a lot of the work that we've been doing is just try to kind of target and prioritize the Lifeline pilot, which again is a 6-month, it's essentially going to be a 6-month pilot, and to really hone in on where that pilot is going to focus in terms of the population served and what services would be provided. So the things that have kind of surfaced the most when we've talked about age has been a desire to focus on youth and young adults, generally ages 13 to 26, but also holding this principle that no one gets turned away based on age, that there may be a lighter touch approach for those who are outside of this age group, and that all the information on anyone who accesses the Lifeline would be tracked so that that information can inform any future work. We talked about system involvement. So, again, should this prioritize more the experiences of people before they've been in systems? So when they're at risk, while they're in public systems, or after they've exited them? And this is one area where we've identified that we need some further clarity from the group. So we'll do some work today to hopefully get there on this question. Throughout the design work group meetings, there's kind of been a case made for serving people at all points of prior, during, and after system involvement. But I think this is an area where we're hoping to get a little bit more clarity on prioritization. And so that will be the basis of some of what we do today. And then finally, for services, we talked about the key elements of services provided through the Lifeline would be flex funding, which is a component of this, an explicit component of this project, but flex funding that would be quickly deployed to meet immediate needs, and that funding would be focused on the target, prioritized population. Connecting young people to advocacy groups and youth advisory boards, navigation of regional and statewide resources, use of peers to staff the Lifeline, this sort of case completion concept of a case not closed until it's resolved, and collecting data on who calls for what, and even if they're not part of that target population. So that is the summary that we've put together of what we've heard from the group. And I just want to pause and just interested to hear again if there's any feedback. Does this feel like an accurate reflection of the work that has been done over the last few meetings? Thanks for the thumbs up, Daniel, because that just made me think of something we could do. And I get, if people are quiet, maybe you're kind of chewing on it, mulling on this. If you want me to go back to anything or scroll to a different part of the page, let me know. But if folks feel ready, maybe we can do kind of a thumbs up means, yep, this looks, you got it. Thumbs down is like, nope, total miss. And sideways would be sort of. So you could do it with, I don't think that Zoom has a sideways thumb, but if you can do either from, okay.
Got a quick question for you, if I may. I apologize. This is my first meeting. I wasn't able to make the others. Are you planning to utilize some element of like case management technology, as it were?
Well, yeah, so case management, that's, good question, Mosen. So I think a couple ways I can think of to answer that. I think the case completion, we are not using that term case management per se, but that, there's some kind of following alongside a person. So that's the concept here. And then the other thing to know is that these themes and these components form the basis of what will go into a request for proposals that we will release, so that we can advise when we're asking, we are basically going to look for an operator, someone who's going to implement this pilot. And we want to communicate through that request for proposals what some of the key elements are, and how it's executed, what technology is used. All of those things would be assessed through that request for proposal review process. So we've tried not to get too into the how the nuts and bolts of all of it would work. We'll get that through the application process.
Thank you.
Kim, can I jump in? And I apologize if you said this. I had to leave the room to get my glasses so I could read this stuff. More evidence I'm old enough to be a grandpa, I guess.
Just zoom a little more.
Yeah. So a couple other points that I just wanted to put out there that I think we heard, and this one I don't know if you captured, but we hope that everybody gets served, independent if they're whatever we decide, whether they're before system involvement, during or after, and that universal sort of service could be basically information and referral. So even if you're not in the group that it gets selected for the pilot to focus on, there still would be that feature that that they would at least help you identify what is currently existing. And the second, I just want to be clear that case completion is, I think, a really good philosophical position to take, and I'm glad we have that. You're right, it's different than case management, but it also doesn't mean, and I'm just saying this to be bold so we understand as the planning group, it doesn't mean the caller or the recipient gets everything they wanted. It just means this entity, the provider, would stick with them until they feel like, wow, these are the 3 resources in your area that are available. So I just want to manage expectations on who that provider would be, what case completion means. Thank you.
Great. Other thoughts or comments? I saw a lot of thumbs up as well as an alien, which was kind of fun. Lori.
Thank you. And I apologize if you already said this. I heard you say that people looked at all these other lines that are available. And so how is what's being talked about here fit within that context?
Yeah, I can attempt to answer to that and also invite my other partners to chime in too. But the way I kind of view that, a lot of what surfaced in the landscape analysis for primarily for young people was for some hotlines that were more mental health counseling or kind of like coaching, not coaching, but like crisis hotline support. And so I think, again, again, the idea here was not to reinvent something that exists, but to fill gaps. And I think what doesn't exist is, a tailored, targeted intervention for a population that has flex funds as a component and can kind of stay alongside. That's not just a referral line. So I think a lot of what's here is built around like the elements that we see already exist in other spaces and what doesn't exist. So I hope that helps. And again, if others have thoughts, please chime in.
Yeah. Oh, go ahead.
No, go ahead, Sam. Yeah, sorry.
I would just say I think the way I envision is very similar to Kim in that the thing that has been expressed from Lyft experts and that has arisen is the intentionality to see the case through to completion and making sure that you get that specific service as opposed to calling something and then being referred to something else or kind of being on your own in regards to like getting that resource. And so I think the level, like the kind of deeper level is what makes it different. But I think I envision this as something that would adequately understand the various this entity would understand the various resources out there and would be able to adequately connect the resources to the young person.
And I was just going to say too, and feel free to correct me if I'm wrong, but I think the Lifeline would be very complementary to existing services. So for example, we know that there's House Bill 1905 that's going to provide very direct services for youth and young adults who are about to age out of foster care. If a young person who would qualify for 1905 doesn't know about 1905 but calls the Lifeline will be like, hey, there's this service, let me connect you. And then the evaluation piece would be, I think, a very complementary way for the Lifeline to make sure 1905 is effective and can be held accountable. So then they would follow up with that young person. Hey, how did 1905 work out? Was it good? Was it not? Oh, okay, well, what else can we do? And then maybe the Lifeline could, utilize flex funds or that sort of stuff to support 1905's efforts, right? So I think that in my head, I'm saying the Lifeline is complementary to what exists, not reinventing the wheel.
I have a question. I don't know that I necessarily understand, like when we say like to reinvent the wheel, because it sounds like what we're designing is a complement to one highlight visibility in spaces where what isn't visibility. And so if it's already invented and we're not inventing, like why are we in this space? Or I don't know how that's making sense. I think it's like right counterintuitive. If it doesn't exist, aren't we inventing it? And I don't know what this is my first meeting. So when the first bullet point for key themes, Kim, is like, right, intent is not to reinvent the wheel. Well, from Black and Brown perspectives, we know in Washington State, we're not accessing current services.
That's right.
And so I don't know if I'm taking that out of context, or if somebody can help explain that to me, that would be helpful.
Yeah, I think what I'd say is just to echo what you just brought forward, which is that there was a recognition that there's a lot of resources out there that aren't being accessed, and it may be because people don't know about them. It could be that they don't trust those resources or feel comfortable accessing them. But the bottom line was like, we know there are resources that exist that aren't necessarily utilized. And so taking that into consideration, in the design of the Lifeline was to, again, make this relational, utilize trusted partners as part of the outreach and the marketing, so that that the service is designed in a way to meet the needs as defined by the people who are trying to access them, not, being defined as part of the design, right? And that the way that the resource is developed in a way that makes, would make this more accessible to folks who may not have traditionally otherwise utilized resources that currently exist. I hope that sort of gets at your,
Sort of a little bit. I think that, I don't know, I just want to be mindful we're not creating a process without one care and consideration for pause. So for example, if we don't know, right, that data or that statistic of, we're just like, this is assumption that, well, maybe they don't know about these resources and that's why they're not accessing it, versus like, right, factual, like we know they're not accessing the service because, well, one, right, it's not a relational space, or it's not inviting, and or right, that just the criminality of just when having to access services for folks needing help is that I'm just wanting to ensure that one, as it relates to, like, for example, marketing and advertising and marketing, that's a high ticket number across the board. One, in that design in itself, it would be nice if we were leveraging our lived experts, because we have a huge community of artists that are experiencing housing insecurity. And so, like, again, like leveraging like the storytelling, if it's visibility and marketing and advertising, perhaps centering those voices, right, to help that framing of the marketing. But again, if like folks, we can spend like X amount in marketing, and if at the end of the day, that's just not a welcoming space for someone, I don't know that we're making best use of our money. And so I don't know what measures or right buffers provisions we want to put in, metrics to measure that. Because I think like that is something we need to be mindful of, because it would be devastating to advertise again for folks that have no interest in accessing those services.
Yeah, I totally hear you. And being a woman of color, I totally understand what you're saying. And a lot of times with these hotlines, what you're getting is a very cold handoff. You're getting access to an 800 number and giving you supposedly access to a project that may or may not be open, may not provide resources on the given day that you need it, closes at 5, all of those things. I think this is a little bit different in that it's kind of an area where the people that are on the receiving end have access to a lot more of the resources. It's all going to be in one place. Also, there's going to be an advisory board kind of keeping the conversation going, so it's not a one and done type situation. And I think when it comes to like the evaluation, that's going to be part of like, I guess what you can call is like the customer satisfaction type thing. Like if you were referred to a situation or referred to a resource and for whatever reason didn't feel welcomed or whatever, like we'll be able to start collecting that information. I don't think that we know it on this level because we don't have access to the data yet. So I think this is kind of the project that allows us to get to the where services are, the why they're being utilized or why not. Because it's a pilot.
I wanted to say something, but Lily, you had your hand up. Are you still on this thread, or are you going to kind of change the angle? Because if you're still on this, I want to defer.
I was not on this.
Well, let me
You go
just
ahead.
Thank you. And then we'll expand it. I think some of the hope and promise of Lifeline is exactly what you've identified, Jackie, is that, and I think that to me, that's part of what case completion means, that if we give a referral to a certain entity, we're going to stay, I hope this program, the expectation is that who's ever got the contract would stick with this young person, even calling back saying, hey, we gave you that
Yes.
number 2 days ago. How did
Yes.
that go? And if they say, man, they just, they just gave me 3 names and hung up, or it was very cold, I'm still stuck, then that not only do we continue to help that young person in that situation, but it becomes a feedback loop to that service that I hope Lifeline would have a way to go back and say, hey, we had somebody call you and they identify as Black and brown and or queer, and they totally felt dismissed by you all. So I think as Lifeline grows into the hope and promise of the vision, it'll have that real-time functionality that I think you've been really articulate since I've known you about expressing. So that would be something I wanted to put into the mix there.
Yeah, that's super helpful, Jim. Thank you for that context. I wish wanting to be mindful, like we're not collecting that data. And then also I would hope that we have a provision in space that allows us to pivot, right? If we're seeing like a high trend early off, if folks have thought and or considered that. But that was super helpful. Thank you.
Yeah, and I'm sorry, the last thing I'd say is lived experience. Folks who have been part of this group, they're actually some of the ones who said they want better marketing in a youth-friendly way that you identified, whether that's storytelling or whatever, but they're talking about even their own state social workers don't know the resources. But I want you to know that came from young people with lived experience.
Mhm. Yeah, I just want to give a testimonial. We have, one of my the programs that I help manage is called Benefit Access, and we have specialists who, when they get a call, they work with the individual, starting where if they have insurance, they help them, apply for Medicaid, food stamp, housing, and all of that. And then they follow up with them after they make the referrals, just to make sure that they have gotten to their appointment. And I also say before they do that, they also look at what obstacles get in the way, transportation, babysitting, what have you. And then when they are let's say they're in the residential program, we've been asking our specialists to call and connect with the individual while they're inpatient treatment, to help set up the expectation that when they get out, they need to be in contact with a specialist so they can get referrals to the outpatient. And we do a whole host of other supplementary services, such as 211, which has access to just about, great deal of resources. In the state of Washington, we keep our own resources at Recovery Helpline. We have a team link that we refer them to. So I want to give a testimonial and say this is really the best way, as far as I'm concerned, and humble opinion. And the other thing that I have a question, is there going to be actual person-to-person outreach or contact connection somehow between the helpline specialist, let's say, and a caller?
I would hope so. If I was to answer that question, I would hope that there's, if need be, some form of being able to directly reach out to people, or being able to again meet people where they're at, in the way that makes the most sense, for sure. I'll let my other partners chime in.
Can I just get clarification? Were you wondering about like in-person contact or person-to-person by phone.
So let's say somebody goes to a Oxford house before they go, right after their discharge, let's say from residential care, and they go to an Oxford house or group home. Would it be permissible, advisable for the person to actually go there and connect with them and do it like in a person, essentially get to know each other in person?
Thank
To
you.
develop that connection, rapport, and everything else that you were talking about.
I would say a couple things. One is probably not in the pilot, but I don't know. We've got a pilot and then it expands, we hope, to other work. Also, that's part of the duplication. If that individual has a case manager or somebody else already
Right.
doing that, we wouldn't want to duplicate that. As a clinician, one of my bugaboos is sometimes young people have more case managers, but still no housing. So I want to make sure that we don't duplicate that. I also want to say, and please don't take this wrong to anybody who this is your first meeting. We have the recordings of the first two so that you can catch up on this. And that's not meant to say don't ask questions, please do. But some of this stuff we've sort of covered and have some good content for you in the minutes and otherwise. Back to you, Miss Kim.
Yeah, is that Lily? You've been so patient. Please go ahead.
Yeah, and please tell me if this has been covered. I'm looking over these recommendations, and the thing that I'm a little bit thinking about is like, if a young person calls this line and like, for example, they need housing, they're connected with like host homes, but they're dependent of the state, like how is the Lifeline like making that distinguishment? I mean, personally, I don't think that we should be making that distinguishment if they need housing, but there is that liability and there is that state law that's still in place. So I guess like, how is this Lifeline being accountable to, like, for example, if a youth is dependent but they're run away, right, and they call the line and they're trying to get outside of the system? And then I guess the second question that I have to follow up with this is like, to what degree can providers access this line, or view resources to be able to help the young people that they're currently serving as well? But those are the two questions that I guess I have, and please let me know if this has already been covered.
Well, your first question, Lily, is a great one, because I think that's part of what we're trying to get clarity on in this. We'll get to that part of the agenda soon, but like, what would it look like if this were focusing on, for example, on young people who are state dependent? How would that work? So I think we need some clarity about how we prioritize where people are in or out of system involvement. So yeah, well, thank you for raising that, to be determined based on, some of the conversation we have today. We have not contemplated providers accessing this, but that's an interesting point that you raise about, but it just has not come up specifically.
Yeah, I mean, I host a lot of conversations with providers, and the number one thing they consistently say is, I need resources, right? And if you're saying like, this is a one-stop shop, like, why can't it also be utilized for people who are helping people if they already have that relationship with the young people that they're serving? But I also understand and recognize that the intentionality of this should be reserved for young people. I'm just wondering if there's a way to make it make the list of like what's on the Lifeline or what's available to young people public, so that providers can also access it as well.
Well, thank you. So I think we are probably overdue to move on, but thanks for all of the helpful additional comments and questions. Not seeing any significant changes to what we have here, more just kind of bringing some of that more to life. But I am going to pass things over to, actually, we're supposed to be taking a break right now. That's what we're doing on our agenda. How does that sound to folks? Do you want to take a few minutes and then come back?
I'm fine with that. Did I miss it? Have we heard from the young people about the lived experience group that we held with just them?
No.
Yeah. I thought that was a little bit to at least but but I also
Well,
know,
I don't see Chelsea on, so
yeah,
that's.
she's ill. So, but I think at least maybe a couple minutes for the others. I just got an email that she's not doing well. So I say we take the break and come back and see if anyone who attended that meeting with lived experience wants to say a couple of words. And then we keep going. Friendly suggestion, Madam Chair.
I am no Madam Chair, that's for sure, but let's do 5 minutes. So 1:57, and you can just turn your video off, but don't go away. Just come back in 5. All right, welcome back, everyone. Should we jump back in? Okay, and I think the suggestion was just to hold some open space for any of the young people who attended the Lived Expert meeting, if you want to share anything from that discussion with the broader group.
This is me trying to bite my tongue and not call folks out. We had a good one, Sam.
Yeah, I'm happy to just talk about a high level. As Jim said, it was a really good turnout. There was a lot of conversations around some of the things that were mentioned before, just around ensuring that there's some intentionality around how you're served when you call the lifeline, and making sure that folks serve you until completion, making sure that folks know about this and that it's really like the awareness is spread in a meaningful and intentional way. Making sure that it's actually like useful and that it's actually serving a purpose and that it meets the needs that people actually have, which is really to the point of that flexible funding. But again, I know there are others on the call who are there, so I want to hold the space for folks. Okay, well, if not, I think we can go ahead and move on.
I think it might have been a curveball since the person that was set up or on the agenda to sort of take the lead is not able to be here due to illness. So, but yeah.
Well, Sam and Jim, I think you two are next. Talk a little bit, like before we do the group work, to talk about some related efforts, political landscape, before we talk about the clarity on target population.
Yeah, so I'll start and then Sam can chime in. I think that the work that we have left to do to identify the 6-month pilot and support the Office of Homeless Youth to really write a good RFP about what someone's going to bid on is to really get clear on the target population. Is it children and youth before their system involved, while their system involved, or after their involvement with systems of care? And I think this is really, really important for a number of reasons. One, we have limited funds and it's only a 6-month pilot. So whoever takes this project has got to be pretty focused right from the beginning. I want to remind you all that we're just talking about the pilot for this upcoming conversation. The hope and promise and vision of Lifeline is to eventually be serving all of those target populations. But we want to be careful, and I think Lily raised it in a really good way. We talked about themes around not duplicating what's already happening. And because of 1905, there is some really exciting work happening that the department, DCYF, is really, I think, doing some really good work on launching ILP, FRS, and we really want to make sure that Lifeline has a clear and distinct lane that doesn't interfere with that active work, both so we can evaluate both pieces of work rather than them bumping into each other. So as you go into this exercise, I really, really encourage you to think about where is a limited amount of money that doesn't interfere with other current work, where we can show the most impact. And I just really, I think, and I'm trying to say this without making a recommendation, but I think if we're in legislative session, trying to get more resources for this, and the question is, well, how is this different from the flexible funding that's in 1905? How is this different from ILP work? We're behind we're behind the 8 ball right away, as opposed to we're trying to do something that nobody else is really doing. We're meeting a gap that's not filled. And so, and I think I would say if it's the pre-system involvement, to be honest, I don't know if we've done enough work yet to really define what does that mean. Is that any family that someone's concerned about might get involved with the system? Is it once CPS is involved? I just don't think we've done that. So I think it's obvious that I'm asking you to really consider that group 25 and older or post-system involvement that has the clearest pathway that nobody else is really addressing at this point that I'm aware of. And so I'll pause there and hand it over to Sam.
I think you covered it really well, Jim. I think, yeah, just continuing to be intentional and thoughtful about how we serve young people and making sure that this is really centered on the experiences of young people and how this can best serve them. I think I think I saw in the chat too, just a question around like how this information will be reported out. And so I just want to acknowledge too that there is a legislative report that will be presented next year as well too, that will capture some of this information and see and say like, this, we got this many calls for this and we got this many calls for Y, right? Like wanting to be able to really get some clarity around what is where's the biggest need. Being like, as Jim said, the hope is to be able to serve all folks, but we really want to make sure that we're intentional during this pilot phase. And even as we go into the next legislative session about like, who are we coming out the gate to serve, and making sure that it would really be a disservice, especially if we make this, if the Lifeline is really truly centered in the experiences of Black and Brown communities, of LGBTQ plus folks and things like that, like for this to be established and then to not continue to get the funding would actually harm and hurt our communities, right? And so that's why the intentionality is really, really important. Lily, I see you have a question.
No, if it's more of a question or a comment, but I just also want to say too, I think that a lot of this really innovative redesign is happening internally at DCYF, but I don't think it's going to be implemented during the time that this pilot is happening. So I also want to be really conscientious about the fact that like, while this pilot is happening, if we're saying we're trying to connect resources, like I just worry about the slowness of the system, like also harming the potential of this pilot. And that's just something I wanted to throw out there, that innovation work is like happening and it's being produced and it hasn't the possibility to have a lot of impact later down the line. Again, I just worry for this pilot purpose, like that, keeping that in mind, that it's not necessarily in place at the moment.
Right. I appreciate that, Lily. I really do. And I still think we could hear from legislators. I mean, that makes me even more nervous if we're in the wrong lane. They would say, well, let's hold off until we know what's going to come from that other work. So I appreciate the slowness piece and I appreciate your sort of encouragement. I don't know that that protects us politically from some of the challenges we'll face. The last thing I want to say is just remind folks that whatever group we pick, who's ever got this pilot will still be receiving phone calls from any of the groups as well in terms of information and referral, and we'll still be collecting data on any of the groups. So if someone calls and says, hey, I'm worried that my child is going to go into juvenile justice or foster care, that might or might not be the scope of the pilot, but that pilot provider would still collect that data that these people are calling because this is that community need. And secondly, still walk alongside them with an information and referral to where they might get counseling or some enrichment service to help mitigate whatever that concern is. So we're really just talking about who is that, which group are we talking about that's going to get, forgive the term, the full meal deal, while everybody's going to get the information and referral, and then they will collect data so we can tell the story.
So I wonder if this would be a good time to kind of transition into the, like, since we're kind of wading into the conversation to do some of the group work. And Shanita, I can't tell if you're back. I got a message from Shanita. She was driving. So, you know, this is her section to lead, but Shanita, are you back?
No, I got the message also that she is not back. She's stuck at school, the kids.
Okay. Well, I can, I guess, so I can lead this section. I'm just going to describe what we're going to do. It'll be very quick. But if Aaron or somebody who has co-host controls could do the breakout rooms, because I cannot talk and do technology at the same time. And I think for the breakout rooms, we just want to do, I mean, they, you know, I guess they can be randomized, but it might be good to have at least like one of the chairs in each, just in case folks need support or have questions. So, but basically we wanted to have a deeper conversation about what we're talking about right here, which is where should the Lifeline pilot prioritize? And I think I'm kind of repeating a little bit of what Jim already said, but ways to think about that would be like, who should, knowing that everyone will be served in some way, but where should the Lifeline focus in terms of who gets case completion, flex funds, and where the marketing is most targeted to. So those are kind of maybe 3 prongs to think about. Where should the pilot focus? I think, you know, thinking in particular about where along like the system involvement journey someone might be at risk, in system, or has exited system. So we'll have these conversations and breakout. There's nothing formal. You don't need to write anything down, but just find, you know, identify someone in your group who can share out with the larger group your conversation, and kind of, you know, if you kind of found consensus or, you know, aligned on an answer to that question. Any questions about what yeah, I'll put those questions in a chat. Thanks, Lily. And also I think probably, like, what do y'all think? We're kind of behind a little bit on the agenda, but maybe 10 minutes for this. Does that seem reasonable?
Got some thumbs up. Sorry, everybody, I'm back. I did have to pick up the sick kid, so let everybody know. Took me a little longer than I thought. Apologies.
Okay.
And I've got the rooms ready and set up when you are.
Does everyone feel clear? Send folks out and we'll come back at like 2:20 and do a little quick report out. All right, let's do it.
And Emily, I'm not sure if you're able to join the breakout room, but you're invited to room number 2 if you're able.
Kim, one of the early questions that came up is, I think the number is 750K. I think I might have misspoken to small group, but can you confirm the amount of money that this contract holds for a potential provider when the RFP goes out?
It'll be close to 700. We're spending some of the money right now contracting and the design work and that part of the process. So it'll be roughly 700.
Thank you.
Okay, for 6 months. Yep.
Awesome. Thank you. Welcome back, everybody. Apologies again for my little snafu. I think now we're going to go into the part where we're going to give everyone an opportunity to just report some of the highlights of the conversations that you just had within the breakout groups. I was a part of group 1, so of course I'm going to pick group 1 to go first. Also, we've got a couple folks that have to leave at 2:30. So Daniel and Danny, if you guys want to start first, and then I could bring in the rear on just some of the highlights that we have. Either way, I could start first too.
Well, I'm happy to take a crack at it, and then I'll lean on you both to fill in the gaps if I have any. So yeah, group 1, we discussed, so the question, let me just pull it up in front of me again. We think that the Lifeline should prioritize for the pilot project, like the money, should be post 25, just because like strategically, I think that's the best way that we can push the Lifeline forward, you know, for current and prior to being systems involved. There's already a lot of investments, like we've already talked about a few, the IOP redesign, House Bill 1905, but there's a big gap with that post 25. You know, let's be honest, like the system likes to forget about folks with lived experience as soon as they become 25 years old. But I think we can all agree that, you know, 25 plus individuals do not have, you know, as a same chance at life, I guess I'll say, as opposed to their peers who never encountered a system of care. And so I think it is good for us to kind of find a lane with this pilot project to invest in folks who have lived experience in public systems of care who are post 25. And, you know, also to note that the Lifeline, the pilot wouldn't forget about, you know, the folks who are under 25. So if a person calls and they're 17 years old or whatever, the Lifeline could still refer them to services. But again, that pilot money, the 700K that we're talking about, might go more intentionally towards post 25. And then Danny also brought up, you know, caseworkers could still call the Lifeline. It'll still just be a service to folks just because it can provide, you know, them with a sense of direction, and it's a low barrier access point. And so that might be enough for those folks and still have a meaningful impact. So I hope that was okay.
Thank you, Daniel. And Lily, to your question, we didn't discuss the upper age limit. We just said the 25 and up. So that might need to be drilled into a little bit more. All right.
I'm sorry,
then
I'll
that
jump
also-
in real quick. I don't think we contemplated an upper limit to those folks once they exit the system of care.
Right. Yeah, no, we didn't.
They could be 40 years old trying to get their medical records and go into the life.
Awesome. Thank you for that, Jim. And then and that also speaks to the case completion, the flex funds, and the marketing, because if you're under those age groups, to Daniel's point, we do have a lot of programs that will support a young person exiting a system of care or having a history of being in a system of care. And we could use some of the flex funds, the support services, some of the dollars to help with those young people on that side. And so the funding, as far as flex dollars, would be just for the group that we mentioned here, the 25 and up. Awesome. All right. If no one else has anything to add from group number 1, oh, Lily's got a question.
I have a quick recommendation though, just to like justify that. I know that we're talking about the pilot, but I think in terms of sustainability, one of the things that I think is becoming really evident out of some of the projects that DCYF is working on is extending services, but it sounds like providers are really looking for that to be like a phased approach. So I'm wondering if we can complement the phase as it's going. So right now, for example, 23 is IL. So I'm wondering if we can do 23 and older, and then because that's technically like that post-service piece as of right now. And then as those programs start to ramp up, we adjust the lifeline to meet that. I think 25 is a great idea. And I also just know right now for Washington State, there's that 23 age that I don't want us to miss in that referral process.
Yeah, I think that's worth capturing. We were thinking, I think, extended foster care but anyway, no, 23, that exiting in the system, I think, is the general term we've used. So.
Thank you for that, Lily. For group number 2, is there anyone that wants to share with the group some of your highlights from your discussion?
Shanita, what group was I in?
I'm not sure. Aaron, can you say
Aaron,
who
what
might have
group
been
was
in
I?
group number 2?
Something tells me we were in group number 2 with the
Group
silence.
2 was Jim, Jackie, Hannah, Gina, and Emily.
More evidence. I
There you
need
go.
all the help I can get. So we had a good discussion, and I'll rely, I hope, on anyone from group number 2 want to speak up, please. Emily, are you comfortable?
Yeah. So we were talking about how it was probably like more beneficial to focus on those exiting the system, just because who was I talking with? Jackie and I want to get the name.
Hannah.
Hannah, thank you. They were saying that before you're entering the system, essentially, you don't even know that you won't have those supports. And when you're in the system, you're having those supports, but when you're exiting, you don't really have anything set in place, set in stone, that's consistent, that's as supportive as when you're in the system. So that's what we were saying, is potentially doing that towards after.
Thank you. Gina or Jackie, anything you want to add, or Hannah?
Were you keeping track of the votes? Because we did have a little struggle. I didn't write it down then.
Yeah, I got like of you group, I only got that there were you and Emily that said exiting. I think Gina said prevention, and I didn't capture if Jackie voted. So please.
Yeah, I landed on prevention during the discussion. I know it's not as concrete of a target to advertise to, but I think that there's a strong payout in the event that can make a change. Though when you're all talking about extending the age to 23 and up, that sounds pretty right-sized for folks that need these services. Yeah, I always like the idea of prevention. Maybe that's the blue sky in me, the naivety, but this is also my first meeting, so I'm open to learning more about this.
Well, the interesting thing too is that prevention would end up being a completely different suite of resources than that will be compiled and shared probably, or focused on, than ones that they would have at the ready of the person who's exiting.
I just got this idea. I mean, like, what if, like, because, like, obviously, hopefully this is going to be an ongoing thing, not just so starting with those exiting foster care, getting their opinion on what would have helped them better while they were in, while also doing the help while what we're doing, and then like just backtracking. So the next, once you've done that part, you go to the next thing. Okay, well, now we're going to help those that are in the system, and then talk to them and be like, what would have helped you not enter the system in the first place? Just backtrack it. Is that essentially what you wanted to do anyway. Am I stating the obvious?
No, I think that's a great comment. Yeah, thank you.
Awesome, thank you. And Hannah, feel free to let us know if that wasn't what you were thinking. All right, room number 3. It's like we're losing people. Room number 3, is there anyone that could report for your conversation?
That would be Kim, Leanne, and Lily.
And Lori Lippold was as well, but she had to leave, so. I will defer to Leanne and Lily, and then I'm happy to chime in, but.
Leanne, do you want to speak or would you like me to go?
You go for it, Lily.
Okay, yeah. So we had a pretty good conversation, and I think one of the things that Lori really talked about was this idea of like what system support sorry, words are hard. System support versus like not having system support. And Lori really articulated this idea that it's a lot harder when you're not in the system to get services. And so services that we can give to people who are not systems involved is really useful. And Lori was speaking on the experience of talking about kinship, right? And those who are in dependency versus those who are not in a dependency. And I think that that's a really, really valid point. And so really re-emphasizing and reinforcing this narrative about post. And then Lori also proposed this idea of, you know, we could do a rural and urban pilot, which is pretty common, one on east side of the state, one's on the west side of the state. But I also brought up the point of like, it kind of depends on what you want to evaluate, right? Rural communities have the issue of like, there's really no resources. So what does it look like to add a resource? Does that actually impact change? And then urban communities really have this other dilemma of like, there's so many resources, people don't know that they exist. Like, would that improve connection? So I guess the conversation of where should we put this resource is more bringing it back to you all of like, what would you actually like to see impacted? Wonder if it makes sense to differentiate between exiting and exited. Yeah.
I wanted to clarify. One of the things when I hear exiting a system of care, I think about that one way as somebody who's still like kind of currently involved, but will be like leaving that system of care and may still be eligible for resources. But I hear folks talking about people who have like fully exited. And I just wonder if that's a clarification that should be brought up.
I think personally, we should be thinking about the words exiting as well as exited, but we should not exclude exiting because we know that a warm, lovely handoff is one way to really help prevent homelessness. And I worry about exited, meaning that a person has to be in that place of desperation before they're able to actually access that resource. So, but does that sound right, Leanne? Like what I just captured. And Kim, does that sound correct? Okay, cool. Thank you, Sam, for that insight as well.
Thank you. Good, I had to write that down. And then is there a group number 4?
I think that was.
Or was that everyone?
Yeah.
Yep, Sam and his group.
Okay.
Yeah, I don't know if Aaron is back, but we also have Mayana and Sherry as well. So I don't know if you all want to report out first.
Sure, I can report out. I think we had a good conversation. We talked about like where we should target the program. And we kind of thought prevention, but then in my time in FRS, I learned the hard way that people seek services when they're in a crisis. And until the crisis happens, I don't always need your service. Just can't see unless I lift my glasses up. And when I went to make an appointment, because now I'm at a crisis mode, like it's driving me crazy, they're like, yeah, we'll see you in 10 weeks. So like it's my crisis, but the system can't respond to a crisis. So my question to Sam was, would the Lifeline be able to respond to crises? Because if it was, then we could do prevention, because when a person needed the service, they would be in crisis and they would want help now. And if they could accommodate that, then maybe prevention would be a good place to start that. If they can't accommodate that, then we would need to think of maybe the back end. That was my own thought. Aaron also thought maybe prevention would be a good place to start, but we didn't really settle on anything.
Yeah, and yeah, I think I want to add some context to that. I know Aaron had to step away for a little bit as well too. So, but yeah, I think really even to your point, Jackie, as well too, that like I don't know, the crisis is the right word either, but being able to recognize that young person is in need. We talked a lot about like what was some of the original design around, like some of the initial conversations around the Lifeline and what was that designed to serve, right? And it's like, I have a flat tire on the road right now. Like I need to be able to like change my tire currently, you know what I'm saying? Or being able to get that, whatever that service is like right now, right? As opposed to being able to, as opposed to having to have something that is later on down the road. So there was some conversation around prevention, just because one, we don't think young people should even have to come into these systems if they don't need to, right? Like, so if we can, divert from system involvement in the first place, like, and there's such a lack of resources in the prevention or for people outside of systems as well. So that's why we landed on prevention. I don't know if Aaron had a chance to come back or if Mayana wants to add something.
No, yeah, I think you summed that up great. I was honestly, I didn't feel like we came to a super solid conclusion, but just, yeah, that we were talking about it and our time was cut short, but that's where we left off. So yeah, I think what they said. I don't really have much more to add to it.
Awesome, thank you. All right, well, if everyone has had an opportunity to report out, and I'm kind of trying to look at the chat as well. Oh, Aaron, did you want to say anything else? Are you good?
No, I'm all good, thanks.
No problem. All right. Well, the next thing on the agenda was the recommendation to the legislature. So with this pilot, there's a couple of reports that are due, and one of them is due at the end of this year. And so we kind of wanted to put out to this team, like, what are some of the things that you might recommend be included in that report for recommendations to pretty much inform the legislature about this pilot. So we know some of the things is definitely the quick turnaround. The 6-month pilot period is kind of a heavy ask. So we know that that's some of the things. We wanted to maybe put out if there's anything else that you might want in that report that should be considered moving forward. Okay, Lily, I see your hand up.
Yeah, is there any conversation about like specifically like extending potentially pilot and like particular, because I just think about like, we all know at RFPs happen, right? And sometimes you get people who actually, especially when you talk about a Lifeline, I don't know if you're looking at like a community service provider to take this on or an existing Lifeline, and just like training up the infrastructure that's needed to handle this. I just worry about 6 months being enough to actually really be able to do that and then also evaluate. So I wonder if there's opportunity to ask for a little bit more of an extension on that pilot timeline.
Well, I'll jump in on this. I think that's our challenge, is that the legislature put this in the budget, in the proviso, so we're limited by that. Part of why we want to make sure we identify a group that gets some results is that during this next legislative session, some of us will be advocating to put more money and extend it. But Kim and Sam may have another insight, but I think we're limited by what's in the budget and the law.
Well, I don't know if I have a different viewpoint, which is I think what Lily just recommended is like a perfect recommendation for the legislature in many ways, because the 6-month pilot will end June 30th of 2023. The legislature convenes in January. We have to submit the recommendations to them in December. And so I think the hope is that we're asking, like, what, the question that is posed is what recommended approaches to continue this pilot program in the next 2-year budget cycle. So I think, to your point, Lily, I totally agree. Like, this is not really enough time to stand up a pilot. So I think that is a valid recommendation, that like, give this pilot more of a runway, like extend it for another year, or maybe the full 2 years, to get enough time to build the infrastructure, to collect outcomes, to learn what's working, what's not. Because that gives the legislature potentially something to act on then when they convene next session.
Right, but you don't see that happening before the end of session, do you? I mean, isn't that the work of session, to get that extension?
Yeah, so we'd have, then that means there would be a budget by April, and we would be able, then we'd have time, the contract wouldn't have concluded yet. And if we got the money and the authorization from the legislature, then we could just extend that timeline and not have it end in June. But yeah, what other thoughts folks have? I'm curious.
So I do have a quick question. So obviously we're deciding on like a main focus group to focus on for the pilot for the first 6 months. But if it was extended, when would that focus be able to, I guess, expand to the other groups to be able to focus more on each one, or would it just remain on one while still kind of helping the others? Does that make sense? I don't know if I worded that well. Okay.
I didn't understand the question.
So okay, sorry, I'll try to word it differently. So for the pilot, we're deciding on a group to be able to focus on. So most people said after people exited. So my question is, if the pilot was extended to 1 or 2 years, would that focus group, in this case, the people who had already exited, would that be the focus group throughout the whole extension, so that whole 1 or 2 years, or would it be or would that change depending on how long the extension was? Does that make more sense?
I think it would. Yeah, it does.
Okay.
It does. Thank you for saying that a different way. I think
Yes.
it would start with the 6 month, like it would start with what we're identifying, because that's what's going to be in the original RFP. But if we're looking at expanding it, I think that the advisory group that's going to be informing, which way this project can go, can say if we're making good, headway this way, or if we need to include more. Like, I think we still have the room to add a different focus group if that's what we were seeing was needed.
And I'll borrow off what Kim did with Lily's question. I think that's a great recommendation to put in the report, which is, so, because again, I think the work's going to happen during the legislative session, and this report that's due in December, I see as kind of an advocacy roadmap. So
Absolutely.
and I hope many of you are involved in that advocacy to the degree you're able. But I think that's sort of the thing is, and not only did we get this part of population going, the recommendation of the group was to expand and then see if in fact the legislature will invest that money to not just keep going, whatever the pilot is, but to start some expansion even as soon as June of 2023. So I think that's an excellent question, and I'd love to hear that as a recommendation for the report.
Absolutely.
Yeah, perfect. Okay, cool.
I think what I also heard this say too is like with evaluation, are we going to be following a cohort throughout there, or is this going to be just like a continuous, like, are we just tracking it quantitatively too? And I think that there's a lot of value in actually evaluating and tracking that cohort, like the first people who come through from a qualitative standpoint. But I also think that there's a lot of value in that like continuous quantitative piece of it. So that's what your comment unlocked for me, and I just wanted to say that.
Awesome. Okay, I've got that noted as well. Is there anything else that we think should be included in this report?
I think too, with expansion, a lot of it's going to come down to funding and capacity. And I think that is going to be an important part of the pilot also, is evaluating the usage of the program. I mean, if it's something that youth really gravitate towards, then you're going to run into, case manager overload. And then, and depending on, if there is an expansion and how much it's funded for, not even an expansion in focus, but an expansion in time, there would have to be a way to build out, not just build through, if that makes sense.
Does make sense.
Yeah, I'll just note an observation, which is it's an interesting task to give the legislature recommendations on something that we have no experience implementing yet, right? So we're in this position of like, well, what do we recommend? Which is why I kind of gravitate toward like, keep this going, keep this pilot going so we can learn from it and build from it. The report that's due to the legislature in June of 2023 needs to require more like outcome data and reporting. And even then I kind of worry we won't have a ton of that, but we'll be able to start that. And so we can be more informed, and then we can therefore inform the legislature, more effectively once we actually, have learned some things from getting this underway.
Awesome.
Well,
Okay,
another thing
and
that,
so go ahead, Hannah.
oh, I was just going to say, is we could start even now is looking at mapping and gapping, seeing what case management is out there now, what resources are out there now, and looking at maybe just some collaboration, and then seeing where case management is missing or where resources are missing.
Absolutely. All right. Well, the last thing that is in this little block was that Kim's going to be writing this report, the initial one that's going to be due in December, and everybody that's been a part of these conversations, you're going to be included in that. Your name could be included in that recommendation or in that report. And if you do not want your name posted, please email Kim to make sure that your name is not included in the report.
And that report, just to build that out a little, we'll be sharing kind of the process, this design work group process, we'll report on like what we put out for the RFP, depending on how the timing aligns, like what applicant we chose to operate the pilot, and then the recommendations. So we intend to include all the participants from the work group meetings in the acknowledgements. But yeah, if you for some reason don't want your name included, that's totally fine. And just let me know.
I think Sam, you're up next.
Right. Well, just as we close, I hope that people feel still hopeful and excited about this project and are excited about where we're at and the fact that we are actually going to be launching a pilot soon. And so just to be able to like convene our brief time together in these short meetings, wanting to just go around the room and have folks say one word about how they feel about the Lifeline and getting ready to launch this pilot. I will say that I am feeling inquisitive and ready to like continue to learn and excited to continue to like unpack all these like really good questions and think about how we continue to really build something that meets a need. And before we get started, can everybody do the hand raise thing so we make sure that we get everybody to say their one word? All right, Colin, you're up.
Oh shoot, I didn't mean to do that. I'm actually going to echo inquisitive, though I think I was going for interested at first. A lot of questions that I feel are going to be addressed by the pilot, but I think it'll be good to get that information and to be able to actually, hopefully fill those gaps as we've been sort of saying. And I suppose I will pass it to Kim Justice.
I think my word is grateful. I feel very grateful for all of you and the others who have participated in this process. We've had such robust conversation, and I think just the nature of the conversations shows how committed people are to this work and figuring this out, and how much we all recognize the need that's out there. So I appreciate how seriously everyone has taken this and all the time and energy that you've put into it. And it looks like Mayana is next.
Yeah, these are really basic words. They're not all fancy, like inquisitive, but just hopeful and excited. I don't remember if this was talked about in the big group or if it was just my workroom small group thing, but we just talked about how there's a lot of resources out there, but not a lot of them are known about or necessarily accessed, for one reason or another. And I'm just excited that, this can kind of be a resource for pretty much anything, and people can be referred, and that they don't have to worry about jumping through all the hoops trying to find out what works for them, and that they can just use this as, I don't remember what the phrase you guys said, something about a one shop all or something. I don't know that phrase, but yeah, I'm just excited and hopeful that people will actually be able to use this, and that it'll go well.
We'll jump to Lily.
Yeah, I'm feeling excited, and I'll pass it to Janita.
Thank you, Lily. I am feeling ready. I really want to see what this is, and I'm ready to get down in it. And I'm going to pass it to Erin. Shame I can't. Sorry, I forgot there was two.
That's okay. It always happens. I'm sorry I didn't get to participate fully today. I had conflicting meetings, but glad to be here. And the word that stands out to me too is hopeful. I shared a story in our small group of a young person who I talked with last week who just didn't know where to go, didn't know where to call. And that made me think of this as a place where a young person could go, and it would be flexible and responsive, and ideally not as overwhelming, hopefully, as contacting more institutionalized and less flexible services. So hopeful that this can meet a need that I think really exists. So thanks for having us. Good luck. I'm excited.
Jimmy T.
Thank you. My word is forward. Let's move this forward. Any good idea, any good program, start somewhere. And I think the key is to get it going forward. So, yeah. And I would say, Emily.
I have two words, even though they're synonymous a little bit. Motivated and determined. Like I'm motivated to do, but the determination is actually helping me like get going. So yes, feeling very excited about this as well. The next person is Hannah.
I'm muted. I would just say that I feel collaborative. I just like how there's a lot of people from a lot of different organizations all coming together to try and solve this.
Sherry.
I'm excited. I'm excited that we're going to move this work forwards and we're going to have new fresh ideas and we're going to get help for the youth that need the help the most. So yeah, I'm super excited on all levels for myself, for my IL providers, for all the youth, just in general, because I think we need more services that are helpful.
Gina. Gina, yeah.
Okay, I was like unmute or lower hand, so many options on this device. I hold hope for the Lifeline pilot. Yeah, we'll stick with that. I'm curious.
Awesome. And Mosin, I think you're the last one.
Thank you. Yeah, I'm also feeling very hopeful and excited and looking forward to learn more about this project. I definitely see it as being a worthy enterprise. And I have been seeing the definite need for it and have had some similar ideas in the past. So I would love to see this pilot come to fruition, and I'm willing to help out any way we can.
Well, thank you.
That's it.
Thank you very, very much. As was somewhat discussed so far in our last couple of minutes, we're on the back end going to be able to kind of finalize, compile these last bits of thoughts. OHY will do their RFP thing. And we will continue to engage this group for a variety of different reasons to do things like overview the potential applicants for the RFP. We would love folks' help, as Jim mentioned earlier, to be able to do the legislative advocacy work. We want this group to help to be a resource and advisory group to whoever gets the contract as well too. And so while this is the last of this type of meeting, this is not the last meeting. So thank you all so very much. We really, really do appreciate all the hard work that you all have put into this and the like brain energy and the thought power that's gone in. Let's continue to go forth and do good.
Thank you, sir.
Thank you all. Bye, everybody.
Thank you. Bye, everybody.
Thank you. Bye.
Thanks.
Thank you all.